So good morning, everyone. Thank you for joining us for this Facebook Live. We have a very important discussion today. We're discussing a pandemic within a pandemic. My name is Iriel Hopkins, and I am the System Director for Community Relations and Diversity here at Summa Health. With me today, we have two emerging leaders, one from Summa Health and one a faith-based leader. We have Dr. Shanu Argawal, one of Summa's infectious disease physicians working on the front lines of COVID-19 pandemic. We also have Dr. R.A. Vernon, co-founder and senior pastor of the Word Church, which has the largest predominantly African-American congregation within Northeast Ohio region. Thank you both for joining us today.
Thank you. Great to be here.
Thank you.
Thank you for having us.
So as we mentioned, we are discussing two public health crises fighting the African American community, COVID-19 and racism, which is why we titled this Facebook Live, A Pandemic Within a Pandemic in the United States. We invite you to participate in the discussion by sharing your comments and questions below. Let's first begin with an update for COVID-19. So Dr. Argawal, can you please share an update for COVID-19 in Ohio as well as the African American community?
Of course. Thank you, Iriel. So as of now, in Ohio, we've had about 45,000 cases, about 7,000 hospitalizations, and 2,700 deaths. Of those cases, hospitalizations, and deaths, 20 to 30% have been in the African Americans. When you look at Summit County, 35% of those individuals that have had COVID-19 have been in our African American community. So this is quite concerning, especially when you see that only 15% of the population in Summit County consists of our African American community. So COVID-19 has disproportionately affected our African American community, and this brings up an issue that's a long-standing issue that needs to be addressed, and that's the issue of health disparities in our African American community.
So you mentioned health disparities and COVID-19 disproportionately affecting the African American. So why do you think that is?
So pre-existing conditions such as diabetes, hypertension or high blood pressure, obesity, asthma have been associated with poorer outcomes in COVID-19. And unfortunately, many members of our African American community are hit by the burden of these underlying conditions and thus putting them at higher risk with COVID-19. In addition, there are other social and economic factors that we sometimes forget about. And if you remember back in March when we just had a few cases, we did a whole lockdown of the area, and that included social distancing. It included working from home. Individuals were encouraged to work from home. Companies were encouraged to have their employees work from home and wearing masks out in the public. But when it comes to our African American community, these interventions are not that easy. Many live in crowded areas, so social distancing is really not always the most easiest to do. The other thing is they often have some essential jobs where they have to be at work. They're unable to have the opportunity to work from home, and often they're using public transportation, which is, again, does not help with the whole social distancing. Lastly, wearing masks out in public. There are some social perceptions behind wearing masks in public with our African American community as well. So those are some of the factors. And of course, last but not least is just access to health care, which is not a COVID-19 issue. This has been a long-standing issue, is the access to health care for our African American community.
Thank you. So what can we do? How can we protect ourselves?
So, first thing with healthcare, I think access to healthcare. When it comes to COVID-19, we need to provide testing within the community. We need to go out to our African American community and provide testing to them. And moving forward, even after COVID-19, I really feel is that we need to focus on preventive health. We need to get the diabetes, the high blood pressure, all of this under control. And this is a good lesson that we've learned, that moving forward, we need to really be proactive in preventive medicine out in our African American community. The other factor is that we need to work with sectors. We need to work with organizations, housing organizations, transportation organizations, businesses to help overcome those social and economic burdens.
Thank you. Thank you, Dr. Argawal. So now we will move into our second public health crisis that we want to discuss here. And I would like to bring Pastor R.A. Vernon into the conversation. And again, he is a faith-based leader and we are talking about racism and inequality. And we know that racism and inequalities directly impact our community as well as our health outcomes. So Dr. Vernon, is now the right time to declare racism as a public health crisis, and why?
The question is, how much later can we be?
Right.
Really, ever since antebellum slavery, racism has been an issue in this country. It is naivety to think that it's not been at the forefront of America's issues. To piggyback on what my dear sister said, it was Malcolm X who said, when America catches a cold, black people catch pneumonia. So whatever is hindering our country, sadly, disproportionately, it always touches black and brown bodies in a worse manner. So absolutely, I think racism is a public health crisis. In so many ways, it should have been declared. And even now, our commander-in-chief, which is a whole nother conversation, should absolutely declare this at the forefront of all of America's issues. Sadly, it took the kneeing of a neck of a beautiful brother of color to finally make America wake up and say, this is systemic, this is a reality, this needs to be dealt with.
Thank you. So you mentioned George Floyd and the unfortunate incident that happened to him. Do you think that incident was the tipping point for multiple people to become aware of the systemic problems that we face?
Absolutely. When persons ask us about Eric Brown, and certainly here in our area, Tamir Rice, the question I've been asked more than anything is, what makes this so different? I think what made it so laborious to look at was the length of time, the narcissism, the arrogance, hand in his pocket, glasses never moving from the top of his head, and to look right into the camera as if to say, you won't be able to touch me. What was happening with him cognitively, that consciously he really felt, you can put this on camera and nothing will happen. I would suggest he wasn't on a suicide mission. I would suggest he didn't want to stay or go to prison for the rest of his life. So something cognitively connected and told him, I'll get away with this. I think what touched us deeply was it took us back again to antebellum slavery with public lynchings. It was the length of it. We've never seen, I thought someone put it very succinctly, we've never seen someone, normally there's a sort of a cloudy camera, it happens quickly, as of the other night in Atlanta, but this was the first time that the police was really in front of the camera. And we watched it for nearly 10 minutes, as it were, a modern day public lynching. And I think for many whites, for the first time, they stopped being white and just became, he saw what happened as a result of it. His bold mama saying, let's put his face on the cover of Jet magazine so the world can see what they did to my baby. But this was the first time that I think white America came face to face with what I would call absolute systemic racism and white privilege, as it were, that white police thought, so what, you have the camera on me, I'll get away with this. I think that was sad for black America and white America too.
Absolutely. So you mentioned this time period of awakening and just vigilance in terms of what is happening for years and years. So moving towards how do we heal as a community, individually, what advice would you give us in the community to work towards healing?
Well, I think this is not the time to use the same rhetoric we've used in the past. I think white America, the dominant culture, has to be at the forefront of this movement. You can't ask us to keep fixing your problem. Even though all of us have a role, white America has to face itself and say, we are at least in a major way responsible for this deficit. You can't dismiss. I keep asking white young people who are saying to me, members of our church, Pastor, what can I do? I say, no, it's not your fault, but you do have responsibility now. You're not responsible for what your grandparents did, or at least began. If my father killed someone and I ran into the person's mother of whom he killed, I would begin by saying, I'm so sorry for what my father did. I wouldn't say, well, that's my father, not me. I would begin from a place of honest transparency and empathy to say, my father did that, and I'm sad about that. So I think white America has to face itself and say our grandparents did something with antebellum slavery in order to make the cotton industry become the largest industry in America, which of course gave America its head start on prosperity. And so to deny that reality and to say, I listened to some conservative African Americans of whom I wanted to reach out and touch and hug and say, please be quiet. As if to say that things are fine and racism has nothing to do with the plight of America today. Whenever any culture has a 400-year head start, it takes that long to kind of catch up. In light of not only Jim Crow Sr., but now Jim Crow Jr., the criminal justice system, that doesn't take away from the personal responsibility of black people. But to say that racism is not real, I just think what happened in Minnesota woke us all up. That even though I'm doing okay, that I live in a decent neighborhood, that I have a doctorate degree, pastor the largest church in the area, that I'm just one police stop from being reminded of how black I am in America. So I think that's a reality.
Wow, very powerful. So we've discussed this on an adult level, but how do we explain what's going on to our children?
Well, again, I think there are two separate conversations. I think, again, it's naivety to say that as a black man, I'm going to have the same conversation with my kids that maybe a white person should. I'm still having the conversation with my children. My son came with me today. If you get pulled over out here where we live, it is still my prayer, watch this, that they don't kill him. It is my prayer that if he gets stopped for a ticket and reaches for his phone the wrong way, that some white police or black police, because also even black police can have perceptions of their own people based on erroneous assumptions, and they kill my son. The average white parent, whether they're honest or not, have to admit they're probably not going to tell their children, the police might kill you today if you get stopped. So I think that conversation has to be one of empathy, to cause them to read everything Dr. King, Civil Rights Movement, Medgar Evers, Malcolm X, Stokely Carmichael, to become familiar with a culture they're not from so that they can identify on another level. Again, not putting them on a guilt trip, but saying to them, if you're not a part of the solution, you then become a part of the problem. I think for years, the talk with white children has not been racism, and it needs to be now. To say to them, no, you're not responsible for everything some person of another color does, but you are responsible to be sympathetic, empathetic, and to do your part, as Dr. King said in his letter from a Birmingham jail to white clergy, that nothing changes unless you see it as a problem. It's not enough just for us to cry loud. Amos says, and spare not. We need everyone to do it.
Absolutely.
So
Very
hopefully
powerful.
that speaks to some of it.
Absolutely.
Yeah.
And before we bring Dr. Shanu Argawal in for last comments, can you talk about a little bit about your advocacy and policy work that you've done in the past on this issue?
Absolutely. I'm a senior pastor, so my lane is to touch all persons of all colors. But in the words of Cornel West, certainly it starts on the chocolate side of town. We pastor about 98% African Americans. I don't think any black pastor can say he has nothing to do with being justice-minded. I think that's impossible. So whether it's been Tamir Rice, whether it's been a few weeks ago even marching with the Black Lives Matter movement in terms of that, whether it's been standing and calling our mayor on issues of justice, pushing our people to vote, doing all that I can as an African American leader to make sure that we stand for justice. I don't think, we all have our calls and lanes, I don't think any African American pastor can afford not to be justice-minded. To that end, again, I think what's now shifted is we need our white clergy to be justice-minded. If equality and a coming together is going to take place, I have no problem saying that right now, yes, we have, I love, and it blesses my heart what Frederick Douglass said in his major Atlanta Compromise speech. He says to white persons, we nursed your children. We cleaned up your mess. We cooked your food. Will you now stand with us? And so I don't think it's unfair to say that the majority of the pressure now is on white persons to say they've been crying for 200 years. It's now time for us. I think the most beautiful thing we've saw is young white millennials and whites of all colors saying we are standing with you. We now see this as an American issue and we need to take the stage now. And watch this, agitation without legislation becomes an exercise in futility. Persons say, I heard one clergyman say, it's not a matter of legislation, it's a matter of Christ changing your heart. Well, I'm from the Christian tradition, so yes, I believe that Jesus can change a man's heart. But Dr. King said, the law cannot make a man love me, but it can keep him from lynching me. So I think we still need legislation, and I think it starts with the commander-in-chief, of whom I'll call out publicly if he's watching. We need a statement from him about reconciliation. We need a statement from him vis-a-vis, does his ratings beat The Bachelor last night? The things he says to me, and I don't care what side of the aisle you reside on, how can you not agree? Public health crisis, and you call persons out just to feed your ego the other night and probably watch the numbers go up in that city just for you to get some sort of egomaniac thrill about how you're popular, as opposed to saying, I cannot. How can the largest American gathering since COVID started be hosted by our commander-in-chief? We can't even go to church. The young lady in Akron, watch this, who lost her life needlessly, yes, sadly by persons of color, it looks like, and now that funeral has to be at the Word Church Akron this Thursday. And we're trying to figure out how do we do that safely and make sure her mother and father and family get some kind of closure. How do we do something that's necessary for closure in public space? And our president has a rally to talk about how great he is, and no one has anything to say, particularly evangelical white clergy. That's fine, as long as you get the Supreme Court nominee you want. So you cannot speak to this dispassionately if you're a person of color or a white person with integrity. You cannot speak to this dispassionately as though that means nothing. I was heartbroken to see those persons. What if one person in there goes home with COVID, stops by grandma's house, and she gets killed because the president wanted to make sure he can win next year or this year in about 5 months? I thought that was sad. And not to call that out again as a white person speaks to your lack of courage or integrity. See, that's what I'm saying. It's not about racism or you not liking whites or you turning on your own people. It's about what's decent and what's not. And until, I'll say it again, whites have the courage, Republicans have the courage, evangelical clergy have the courage to say that was wrong, then nothing will change.
Thank you. Very powerful thoughts. Dr. Shanu Argawal, would like to bring you in the conversation. Is there anything that you would like to comment on this topic?
Yeah. I'd like to thank Dr. Vernon for your powerful thoughts. It's really been a great segue for my last few comments. And I just wanted to end by saying, you know, we are facing a crisis within a crisis at this very moment. And with that, I acknowledge, I respect the freedom of speech, whether it's through social media or through the demonstrations, but all I request from everybody is that we do it in a safe way. We still practice social distancing. We practice good hand hygiene, wear masks, and with that, those are my closing remarks.
Thank you. Thank you very much. So with this ending, we are going to take a couple of questions from the audience tuning in. So Monica asks, what is SUMA doing to change or address the Black community and the issues of racism? And so I definitely can take this one. I mentioned earlier, I'm the System Director of Community Relations and Diversity. And on June 1st, we put out a statement, like many other organizations and companies did. But one thing that we wanted to do that was different was to not only address the situation at hand, but we also wanted to follow that with action steps. We know that the community at this point want to see action. Again, as Pastor Vernon had mentioned, we can, say what we want, but if there's no legislation or action or policy behind it, then there are just words. And so as we were releasing the statement, we were definitely working on our action plan. And so we are excited to share that with you all, our SUMA friends and viewers, within the next coming weeks. So I'll move on to our second question. Larry asks, when will it be safe to go back to church? So I will direct this question to you first, Pastor Vernon, and then Dr. Argawal.
Well, again, I think that's relative to your size, your context, again, maybe culture. In the Black church, we spit, shout, and hug. Three things that COVID-19 probably would love to see happen. So for us, maybe for the first time, a mega church is at a disadvantage in that we're so large. And again, our style of worship, it's hard for us to have a kind of vanilla worship where we don't hug and run and shout. That's just part of the Black church ethos. So I'm going to err on the side of safety. We've been doing our best to, shameless plug, the Word Church official YouTube page every Sunday, 10 a.m. We've been trying to produce some of the best services we can. We've been doing it from my ranch. We've been doing it different places at the church with just a few people, drone shots, and making it pretty to sort of just wait a little while. In the words of Janet Jackson, let's wait a while. I just think it's time to hold on, because I want to err on the side of safety out of honor for what the great doctor said. I think mean COVID-19, whether we like it or not, it's real. Again, I want to go back to our president, but it's real. And I'm not a purist now. Let me be clear. I'm not a purist. I wanted to hug you when you first came in. I think I hugged somebody. I said it. Pray for me. I got to get better, because it's hard for me. I don't like the word social distancing. I like physical distancing. As a Christian community, God said it's not good that man should be alone. So we're Zooming. I like physical distancing more than social distancing, because we need to socialize, but just safely. So for us, we're going to wait a while. So our members are getting antsy. I'm antsy. Some smaller churches with larger spaces, maybe they can go back this weekend and sit separately. The governor said he's not intervening. I was on a conference call with the governor, and he clearly said to churches, go back at your own discretion. He recommends outside services, of which we had this past Father's Day. He recommends physical distancing, but he says whatever you think, you do.
Thank you. Dr. Argawal?
And I agree with Dr. Vernon. I think the physical distancing is important. Areas of worship are extremely important for individuals' mind, body, soul, and I think that it's important to have to open services, but do it in a safe way. So limit the amount of people, and I would encourage masks. I know it makes it a little impersonal, but it's just where we are right now, and we have to do what we have to do. But I agree with all of Dr. Vernon's comments.
Thank you. All right, so our next question. Charlene asks, my mother is at high risk and showing signs of COVID. Where can we get help? So I will direct this question to Dr. Argawal.
So we do have a testing event that is going to be held this weekend on June 27th and 28th at the House of Lords, and there's quite a bit of information at the SUMA Health website, and we are partnering with the Summit County Public Health to provide testing. So she can be tested at that site this coming weekend. So that's where we'll be doing the testing.
Awesome. And I know we also have a Center for Health Equity, which has a lot of specific and culturally appropriate material and services and programming within our community. And so we have multiple programs and ideas and thoughts and suggestions for everyone staying safe. And we've created a page in which I will give that page at the end of our conversation here. So if we don't have any other questions, I would like to thank you all for tuning in. I would like to thank my guests for tuning in.
Thank you.
And as we mentioned, you can visit sumahealth.org/COVID resources for additional culturally specific resources and information on future dialogues that we will host. Thank you and have a great evening and enjoy the rest of your day.